one great thing about green tea is it's a prebiotic for your oral microbiome and your gut microbiome. So just like you've got all those 40 trillion bacteria in the gut, you have about 7 trillion bacteria in the mouth, which are very important. And research now indicates they are key regulators for inflammation and also autoimmunity. So making sure your oral health and your oral microbiome is important, is in a good place. So with green tea, what you do is just swish it around your mouth for a few seconds before swallowing, and that way you get those oral microbiome and then the gut microbiome benefits when you swallow.
Let's stick on that oral microbiome piece. I'm glad we went there. So we know green tea can be beneficial. Let's start by talking about some of the things we might be doing now, like mouthwash or using certain toothpaste, that could be destroying that.
Yes. So I think most commercial mouthwashes, are very harmful, for the oral microbiome. I think with toothpaste as well, you want to make sure you get a pretty clean product. I especially like toothpaste with xylitol. So xylitol is a sugar alcohol extracted from birch trees that has been shown to help with the biofilm, which is a key concept. So biofilm is how bacteria congregate, and that's how they reside, in the oral microbiome and throughout the body. And xylitol improves the biofilm. It shifts it from potentially pathogenic to more beneficial. So I think incorporating toothpaste with xylitol, there's many out there now, is excellent strategy. Another thing that often worsens the microbiome is mouth breathing. So people often don't realize at night, especially, their mouth breathing. And then because saliva is such a key factor for oral health, when you are mouth breathing, you get the dry mouth and the loss of saliva, which allows bacterial overgrowth. So the simple strategy of mouth taping, which a lot of my patients have done, can help resolve that while you're sleeping, to prevent mouth breathing. And then finally, cavities and infections can be present. Root canals are often problematic. So not in all cases, but for some, root canals can be a hidden source of infection, which can drive inflammation. So you'll want to pay attention to all those different factors.
And for somebody who is scheduled to have a root canal done and they're weary about having that procedure, what safer alternatives, or are there any, they can look to?
Yes. So with root canals, you have the option for working with a biological endodontist. So an endodontist is a specialist in root canals, and you want to really consult someone like that because they have special technology, like an X-ray known as the cone beam X-ray is a much better way to assess the the root canals than conventional X-rays. And then there are techniques using, for example, ultrasound or ozone therapy, to help address these infections. So a lot of different strategies that can be used there.
How do you feel about cavitations from previous wisdom teeth surgery? This is something that comes up from time to time in the health world, and it's not brought up enough, I would say. Is this something you're informed on?
Yes, I agree. I think cavitations are a key factor, and I think that it's important to look into that. So that can be a hidden source of inflammation, hidden source of infection, and I think important not to be overlooked.
While we're on the oral health category, one of the things I've been doing for years, and I really like it, is to use a tongue scraper first thing in the morning.
Yes.
You do. I believe you talk about those in your book. Talk about your feelings behind it.
Yes. So I think a tongue scraper is an excellent strategy in terms of getting the bacterial count on the tongue reduced significantly is reduced with tongue scraping. And then another strategy from Ayurveda that is very powerful is oil pulling, where you include coconut oil and are able to, just swish it around your mouth for a few minutes. That is excellent antimicrobial and really good for the oral microbiome as well.
If you enjoyed that clip, press here for the full episode. I'll see you over there.
What we often see in autoimmunity are certain parts of the immune system are hyperactive. Those are the attacking the tissues, producing the autoantibodies, and other parts are actually suppressed, like the part that's supposed to